You're listening to the Turn Autism Around podcast. I'm your host, Dr. Mary Barbera, and today we are talking about the first step of the Turn Autism Around approach, which is assessment. And it's important to assess every child in every situation where you want to decrease some problem behavior and or increase a pro-social or quote-unquote good behavior. So let's get to this important episode on assessment. Welcome back to another episode of the Turn Autism Around podcast. You can and should pre-order my new book, Turn Autism Around, an action guide for parents of young children with early signs of autism. And you can get all the details at turnautismaround.com. If you pre-order, you'll get all the pre-order bonus videos and get a sneak peek at the book too. This episode I'm going to dedicate to assessment. And in the Turn Autism Around Approach book, there is a whole chapter on assessment. So I'm going to pull out some of the key things in that chapter to give you a glimpse. I've talked about assessments before. I've done a video blog or two on assessments. We can link those in the show notes. But there are 4 steps to the Turn Autism Around approach, and assessment is the very first step. So before we start with assessment and where you start, I do think it's important to kind of go backwards and say, basically every question I get can be categorized in 2 different categories. So question number 1 category I get from members of my online community, podcast listeners, questions we get over email. So the number 1 question we get is, how can I get my child, client, student to stop blank? So you can fill in the blanks with any kind of problem behaviors like crying, biting, hitting, lining things up. So how do I get my child to stop biting? How do I get my child to stop hitting? Those sorts of things. How do I get my child to stop scripting from movies throughout the day constantly? So that's the first category of questions I get. And the second category of questions I get is, how can I teach my child, client, student to blank? And you can fill in the blanks with, how do I teach my child to talk? How do I teach my child to brush their teeth, to get dressed, to walk to the playground, to potty train, to sleep in their own bed through the night? So, as I said, one of the chapters in the Turn Autism Around book is all about assessment. And we discuss assessment throughout the book in a lot of chapters. When we talk about talking, we talk about an assessment. When we talk about potty training, there's a special assessment on that. When we talk about eating, we do a food, kind of a 3-day food journal as an assessment. We also do a food, easy, medium, difficult food sheet. Those are all assessments. We're not going to talk about every assessment that I would recommend, every assessment in the book, but we're going to talk today about the 4 easy assessments that you can start literally today. Even if your child already goes to an ABA clinic, even if you just had reams of assessments done, I'm going to tell you the 4 easy assessments you can and should do right now so that you can get a very good snapshot of your child or clients. As I said, assessment is step 1 of the Turn Autism Around approach, but let me tell you what the other steps are. It's basically the scientific method. When we look at a problem, we assess. That's step 1 of the Turn Autism Around approach. We plan, which is step 2. We teach or intervene in some way. That's step 3. And number 4 is we evaluate with easy data and we kind of start over. So within each child, though, we might be assessing or reassessing in the feeding area. We may be planning because we're right before an IEP meeting, but we can't just jump into the planning step without assessing or reassessing. So they all have to go. It's almost like a circular motion as opposed to like a straight line, because you're constantly assessing, planning, intervening, and evaluating. And it's almost like loops throughout the day in every area. And we use the scientific method to solve any problems. We will use the 4 steps of the Turn Autism Around approach to solve problems as well. And we will use that approach, my approach, the Turn Autism Around approach, to answer those 2 categories of questions. How do I stop blank? How do I teach my child blank? One thing I want to make clear is that assessment and the other 3 steps of the Turn Autism Around approach is not just for professionals. Parents can and should learn how to do the assessment to improve their lives, their child's life, and even your typically developing kids. It's the same process. You think your older child might have a learning disability. Okay, so the first step is assessment. And go on from there. So the other thing I want to make clear, it's not just for professionals, it's also for parents. And number 2 is that assessment is not a once and done thing. You'll need to regularly assess your child or clients. And this is important so that you can continuously plan, intervene, and make day-to-day based decisions to make sure that you're making the most out of your child's time. So back to our top 2 categories of questions. How do I stop blank? How do I teach my child blank? But before I can even begin to answer, I need to know at least 2 things. When a member of my online community asks me a question, I always ask for these 2 pieces of information, which are first 2 pieces of assessment: the child's age and the child's general ability level in terms of talking, tantrums, and self-help abilities. So age and ability level are your 2 first pieces of assessment. Because the reason I ask for age and ability level, if you have a question about potty training, but you have a 4-year-old who is almost conversational and flops to the ground and hits others twice a week, and you have a question about potty training, or if you have a 5 or 10-year-old child or client who is speaking in one-word utterances, aggressive 10 times per day, and not potty trained, my answer to your potty training questions will be different. Sure, it's very important that a 5 or 10-year-old become potty trained, but if they are aggressive 10 times per day and refuses to sit on the toilet, we have to start there. So the other thing, when people ask questions and they go into these 2 categories, it's not always like you want to tackle the teaching question if they're having major problem behaviors. And especially as the child gets older, their hits or their flops to the ground become less safe as the child grows bigger. So the key here is to complete the 4 easy assessments, which I outline in a chapter of the Turn Autism Around book. As I said, there are a few assessments like the sleep and the eating, easy, medium, difficult assessments that we're not going to talk about. But you should definitely pre-order the book, turnautismaround.com, and you'll be able to get the book resources, including samples of the easy, medium, difficult sheets and all those kind of things. But I didn't want to overwhelm you with every assessment under the sun. We're going to talk about the 4 easy assessments that I would recommend for all of you listening. And these are going to be detailed in the show notes as well and available as a book resource. So the first assessment that I would recommend is an assessment I created. It's only a 1-page assessment, so everything is really tight and very much like a snapshot. The 1 page will only take you as a parent or a professional to interview the parent about 10 minutes to complete. There is some, if you're not sure if the child can say star when you say twinkle, twinkle little, if you don't know that, then there's some testing to be done with writing down the answers on the one-page assessment. This is really important to do this one-page assessment. Like I said in the beginning of this podcast, even if you have reams of data, even if your child was just assessed by a professional, getting this snapshot in all areas is super important. There's 3 columns of this one-page assessment. And on the first column, we'll talk about, does your child or client have a diagnosis? Do they have allergies? How do they sleep, potty train, eat? Do they use a pacifier or a bottle? And these are really important because some parents, if you don't ask the question about pacifiers or bottles, won't bring it up. They don't know that that's part of an assessment that is going to probably be impacting quite a bit of talking. Children with no ability to speak will probably have issues with eating a variety of foods, pacifier addiction, drinking from straws and open cups. These all might be part of the issue. The kids without any language also will probably have social skill deficits and problem behaviors due to a lack of communication. So getting all of this on one sheet, quickly assessing and taking a snapshot that can be redone every 3 months, every 6 months, every 12 months. And that is the one big assessment that I would recommend for all of you. And if your child is, especially if they're under the age of 5, you will also want to review typical milestones so you can compare your child's ability with what's expected. And I talk about that in the book as well. You might think I don't want to, find out that my 4-year-old is speaking like a 9-month-old. Or I don't want to know that he should be drinking out of an open cup and a straw and he's, at 18 months of age and he's now 5 and not doing that. You might think it's depressing to find out, but you have to see where your child or client is at developmentally and meet them there, working with their strengths and trying to catch up their deficits as much as possible. So you have to assess to get your starting point. And you have to start where a child is at developmentally, not what their chronological or real age is. And so I think knowledge is power. And I think you looking into developmental milestones is important. As I said, we have lots of things on this one-page assessment, not just allergies and diagnosis and self-care, but all the language broken down into the different verbal operands, whether a child imitates, whether they have matching and puzzle skills, what their social skill deficits are like, and finally problem behaviors. And we take all of this together to really begin to see where we're going with the plan. Okay, so the first assessment is the one-page assessment. The second assessment that I encourage all my online participants to do, I'm going to encourage you to do it, I encourage it in the book, is to complete the 4-part self-care checklist developed by Dr. Mark Sundberg. He was gracious enough to allow me to republish parts of the self-care checklist within the Turn Autism Around book. And Dr. Sundberg created this self-care checklist when he created and published the VB MAP assessment. So Dr. Sundberg, how he created these self-care checklists was he looked at all these developmental milestones and saw when typically developing kids are supposed to drink out of an open cup, or when kids are supposed to use a knife and a fork, or when kids are supposed to bathe themselves or wash their hands independently or brush their teeth. And so there are 4 chunks of the self-care checklist. Again, not to depress you. And if you have a 9-year-old or a 12-year-old, it doesn't matter. Look at these developmental checklists and see, because I did an independent evaluation. I think my last independent evaluation ever was a 17-year-old, and he took a bottle of water and he drank. And when he drank, he didn't move his lips to cover the hole, so he would get water all over himself. And he also was minimally verbal and vocal. So I asked his staff, I'm like, can he drink out of a straw? And they said, I don't know. And so they brought in a straw, and sure enough, he could drink out of a straw. And so drinking out of a straw is an 18-month-old skill, even though this young man was 17 years old. And drinking out of straw will help oral motor. It'll help hygiene, keep him cleaner. It's just better all around. So doing this, even if you have an older child, is important. Okay, so first assessment is the 1-page assessment. Second assessment is a self-care checklist, all 4 parts. The third assessment, which I would recommend you do, is to take 2 different 1-minute videos. 1 minute of your child or client. If it's a client, you're going to have to get permission to take videos. These aren't videos you send in. And even if you're part of my online course and community, we don't collect them. We don't look at them. You don't post them. 1 minute of your child alone doing something. And then a minute, or you could do 2 minutes of you trying to engage your child or client in an activity. And this is used as a baseline information so that as you implement the Turn Autism Around approach, you'll be able to see pre and post. Just like if you're trying to lose weight or make improvements in some area, you might weigh yourself, you might take a picture of yourself and before and after. And you might also weigh yourself before and after. And these are 2 great pieces of information that can really help you and the team see the improvements. Okay, and the very last assessment, which you can decide if it's going to be 10 minutes, 15 minutes, 30 minutes, 60 minutes. You set a timer and you do a baseline language sample where you're going to want to write down your location, and then you're going to pay attention. So if you can't sit with your child or clients and you don't have 60 minutes, set your timer for 10 minutes and write down your location, try to get your child to talk, and write down every sound or word approximation. If you have 0 words, 0 sounds, that's fine. You just write that down. Again, this is like weighing yourself before and after, because hopefully the strategies that you will learn in my new Turn Autism Around book, in my online courses, will help you make progress. So that some people take baseline language samples every day, every week, every month, every 3 months. It's up to you. But again, the more information we have, the better we can help our children and clients. So, as I said, there are also other assessments throughout the book for behavior reduction, ABC forms, a calendar data system, just lots of assessment tools on feeding, sleeping, potty training. But for now, I would focus on these 4 assessments: the 1-page assessment, the 4-part Mark Sundberg self-care checklist, the 2 very short videos. Just take your phone and take some videos. 1, child alone. Don't even make a big deal that you're videotaping. You really want to get them doing whatever they're doing alone, and then 1 minute with you engaging them. In summary, the first step to reducing problem behaviors or teaching any new skill to a child with autism or signs of autism needs to start with an assessment, age and ability level at the very minimum, even to answer any questions. But in general, to get the ability level, you're going to need to do those 4 assessments to get a really good sample. And the whole thing together should only take about an hour if you are going to do a 10 or 15-minute language sample. You can get all 4 assessments done within an hour max. So I would, if I were a professional, I would work with the parent to direct them. Maybe they could take the videos and keep the videos. It's also super motivating if you can really see a lot of gains. And if you're not seeing a lot of gains, then something is wrong and we need to dig deeper, not say, well, the child just has an intellectual disability and they're not able to learn. Every child can learn and make progress, and we need to figure out how to best help them make the fastest progress in the least amount of time. If you're a parent or early intervention professional working with young children showing signs of autism, or if you're a parent or professional helping older children with moderate to severe autism, you'll definitely want to pre-order my new Turn Autism Around book today. You'll get early access to exclusive bonus content that will help you right away. For all the details, go to turnautismaround.com.